Assalamu alaikum. Our lecture today is dealing with vitamins. We are going to discuss the general characteristics of vitamins, their sources, how they are classified, the chemistry, and deficiency manifestations. Let us start by discussing the general characteristics of vitamins. All vitamins are organic compounds. By organic compounds that all vitamins contain carbon atoms. Vitamins are essential for normal growth, differentiation, and development. All vitamins are not synthesized inside our body, so they have to be supplied in diet. With few exceptions. The first one is vitamin D3, which can be synthesized from cholesterol, and the vitamin niacin or nicotinic acid, which can be synthesized from the essential amino acid tryptophan. Vitamins are not broken down inside our body and give energy, but they help in the production of energy by acting as coenzymes for the various chemical reactions. When we look to the classification of vitamins, we can classify vitamins into two major groups. The first one is the fat-soluble vitamins, and this group includes vitamin A, D, E, and K. The other group is the water-soluble vitamins, which include vitamin C and vitamin B complex. Let us compare between the water and fat-soluble vitamins. The water-soluble vitamins are soluble in water, but are not soluble in fat solvents. Because they are water-soluble, they are easily excreted in urine and cannot be stored or not stored in appreciable amounts inside our body, with the exception of vitamin C and vitamin B12, which can be stored for appreciable time. Vitamin C can be stored inside our body for about 6 months, and vitamin B12 can be stored for a few years, 2 or 3 years. Because the water-soluble vitamins are soluble in water, they are absorbed by the portal circulation to the liver, and as a result, bile salts are not required for their absorption. Again, because they are water-soluble, they are not stored inside our body, so toxicity is not common in case of water-soluble vitamins. No carrier is required for the water-soluble vitamins because they are easily mixed with the water of the plasma, with the exception of vitamin B12, which needs a carrier. Deficiency manifestations appear rapidly for the water-soluble vitamins because they are not stored, with the exception of vitamin C and vitamin B12. If we want to treat deficiency of the water-soluble vitamins, they will require regular treatment administration, again because they are not stored and easily excreted. On the other hand, the fat-soluble vitamins are insoluble in water but soluble in fat solvents. They are not excreted because they are fat-soluble. They are stored inside our body, mainly in the liver, and for their absorption, they require lipids and bile salts for their absorption, and they absorb it with chylomicrons. Toxicity is more common in fat-soluble vitamins because of their storage. Carrier proteins are required for the fat-soluble vitamins, and deficiency manifestations appear late when the stores are depleted. In the process of treatment, single large doses may be sufficient because it is stored inside our body. What are the sources of vitamins? Humans can get vitamins from mainly three sources, but the most important source is through food, whether it is animal or plant foods. With one exception again, vitamin B12 has no plant sources. Other vitamins like niacin and vitamin D3 can be synthesized inside our body. Other vitamins may be synthesized by the intestinal microorganisms like biotin, vitamin B12, and vitamin K2. But these vitamins, which can be synthesized either by our body or by intestinal microorganisms, would not be synthesized in sufficient amounts, so they are required in the diet also. What are the different causes of vitamin deficiency? Vitamin deficiency may result for several reasons. It may be due to decreased intake, as in famine, alcoholics, poverty, etc., or due to decreased absorption, as in biliary obstruction, so the fat-soluble vitamins would be, their absorption would be decreased. In malabsorption syndrome, vitamins are decreased in their absorption, and in case of vitamin B12, if there is lack of intrinsic factor, vitamin B12 will be deficient, leading to pernicious anemia, and that may result from inflammation of the gastric mucosa, or in case of cancer of stomach, or even after gastrectomy. Vitamin deficiency may result also from decreased utilization, as in case of vitamin A. Vitamin A requires a transport protein termed retinol binding protein. If such protein is not synthesized by the liver, so vitamin A would be present in the food, absorbed, but it cannot be transported inside our body, and deficiency manifestations would occur. Again, vitamin D3 may become deficient not due to decreased intake in food or absorption, but due to decreased activation in the liver and kidneys. As in case of liver and renal diseases, vitamin D3 would become deficient, as we will see later on. Again, the folic acid needs a process of activation into tetrahydrofolate. If such process of activation does not occur, so deficiency of folic acid would happen. Vitamin deficiency may result when there is increased requirements, as in females during pregnancy and lactation, in children during growth, during convalescence from diseases, and due to increased excretion, as in certain renal diseases. It is important to notice that some drugs may induce vitamin deficiency, as in case of prolonged antibiotic therapy. Such antibiotics would decrease the synthesis of the vitamins synthesized in the large intestine. Again, a drug for treatment of tuberculosis termed isoniazid would decrease the absorption and increase excretion of vitamin B6. So vitamin B6 deficiency may appear in patients taking this drug. As we mentioned, vitamins are classified into two broad classes: the fat-soluble vitamins and water-soluble vitamins. The fat-soluble vitamins contains vitamin A, D, E, and K, while the water-soluble vitamins are classified into vitamin C or L-ascorbic acid and vitamin B complex. The vitamin B complex contains many vitamins that will be discussed later on. Let us start by the first fat-soluble vitamin, which is vitamin A. Vitamin A is termed a group of chemical reactions. All are having the function, the same function, and they are termed retinoids. Vitamin A main function is to protect against dryness of the eye, so it is termed anti-xerophthalmic vitamin. If we look to the chemistry of vitamin A, we'll find it is present in three different forms: the alcohol form, ending by CH2OH, it is termed retinol; the aldehyde form, ending by CHO, it is termed retinal; and the acid form, ending by carboxyl group, and it is termed retinoic acid. All these are termed retinoids. Retinoids so would include the alcohol form retinol, the aldehyde form retinal, and the acid form retinoic acid. There is a pro-vitamin A. Let's say when it is cleaved, it will provide vitamin A. These are termed carotenes. From such carotenes, there is beta carotenes, and the beta carotenes are formed when it is cleaved by the intestinal enzymes. It will be converted into vitamin A. All vitamin A different forms are formed from an isoprenoid side chain and a beta ionion ring. Both are required for their activity. Vitamin A can be present in three forms, as I mentioned. It can be present in the retinol or the alcohol form, retinal or the aldehyde form. These two forms are interconvertible by oxidation reduction reactions. Conversion of retinal into retinoic acid is a single pathway. It is irreversible when retinal is further oxidized into retinoic acid. Now, what are the sources of vitamin A? Vitamin A, the beta carotenes are provitamin A. As we mentioned, they are cleaved inside our intestine to give vitamin A. Sources of beta carotenes are of plant sources. They are present in colored vegetables and fruits such as carrots, mango, sweet potato, tomatoes, etc. While the vitamin A itself is present in animal sources like the cod liver oil, shark liver oil, milk, butter, egg yolk, etc. What about the metabolism of vitamin A? Vitamin A is absorbed with lipids in the form of chylomicron from the proximal small intestine, while beta carotenes or carotenoids can be either cleaved into retinal or absorbed as such with vitamin A in the chylomicrons. So carotenoids, which are beta carotenes, why we say carotenoids? Because we may have alpha carotenes, beta carotenes, gamma carotenes, etc. Carotenoids can be cleaved by the intestinal enzymes into vitamin A or can be absorbed as such in the chylomicrons. Chylomicrons, as we all know, will be transported to the lymphatics, then from lymphatics to the blood, where they are stored in the liver, bound to retinol binding protein inside the liver cells. When in case of body needs, it is released into the plasma, again circulates in the plasma bound to retinol binding protein. That's why if such carrier protein is deficient, vitamin A deficiency would result. Retinol binding protein deficiency would result if there is liver cirrhosis or liver disease. What are the functions of vitamin A? Vitamin A in the form of retinal is important for vision. In the form of retinol, it is essential for normal reproductive system, but this has not been proved in the human. It may be in animals like mice. Retinoic acid is essential for the normal growth and differentiation. Beta carotenes, when they are absorbed as such, are having a protective effect against atherosclerosis and cancer because they act as antioxidants. So they are able to trap free radicals in our tissues. Other usage or other functions of vitamin A may be in the form of creams that are used for the treatment of acne vulgaris, and these creams contains retinoic acid. But we have to observe that retinoic acid in such drugs or such creams may have very high and serious adverse effects because they are teratogenic drugs. Teratogenic drugs, that to say they induce malformation in the growing fetus. So pregnant females or females that intend to become pregnant should not use such kind of drugs. Again, I would like you to know that the retinoic acid or the acid form of vitamin A, it acts like steroid hormone. By that we mean that it can penetrate the cell membrane, bind to intracellular receptors and make a complex, and such complex would activate certain genes for the production of specific proteins, as we will see later on the function of vitamin A. Now, what are the manifestations of vitamin A deficiency? Vitamin A deficiency would affect the following organs. It would affect first the eye, and it produces manifestations that can progress, if not treated, into complete blindness. And the eye manifestations, it causes night blindness or nyctalopia, and night blindness means diminished vision in dim light. Xerophthalmia or dryness of the eye, the conjunctiva become dry, thick, and loses its normal luster. Again, Beteau spots will appear on conjunctiva. They are thickened, opaque, grayish-white spots due to keratinization of the conjunctiva. Keratomalacia or softening of the cornea, that may lead to perforation of the cornea and loss of vision due to the perforation and superimposed secondary infection also. Beside the eye manifestations, skin and mucous membranes can be affected due to vitamin A deficiency. The skin, it will cause xeroderma, that's to say dryness of the skin, and the hyperkeratosis. The skin becomes dry, rough, resembling goose skin. Again, there is keratinization of the mucous membrane of the respiratory, gastrointestinal, and genitourinary tract, with reduced mucus secretion. This will result in increased urinary and respiratory tract infections. Patients with vitamin A deficiency are prone to develop bronchitis, urinary tract infection, etc. Thank you.